So great to have you. I love that. I love that we have this energy persons coming in. So I'm just going to invite us while we're waiting on other people to sort of check in to the room and get themselves situated. I'm going to share, or going to invite you rather, to sort of take a moment to think about this connection question that we just posted in the chat. Don't overthink it. It's just a really simple question. You can just type your answer in the chat if this works for you. But essentially, can you think of a time when you experienced or witnessed a subtle interaction that left a lasting impact? How did that make you feel? And what were the immediate or long-term effects of that interaction, right? So if you can think of an experience, maybe something that happened to you or something that you witnessed that left an impact. How did that make you feel? And what were the immediate or the long-term effects of that? Welcome in, Karel. I'm having a lot of fun trying to figure out my screen stuff here. It's good to have multiple screens. So if I'm not looking in the right direction, I apologize. And I was chided recently for not looking at the camera. I actually do prefer to look at the faces on my screen as opposed to looking at the camera. So that is what I tend to do. And so please bear with me. All right. Welcome in, Cherie.
Thank you.
Good to have you. There's another Jamaican accent, Chantal. Welcome in.
Here.
All right. So if you're just joining us, we just posted a little bit of a connection question in the chat. SJ might have to post that again for those who just came in. So can you think of a time when you experienced or witnessed a subtle interaction that left a lasting impact, right? How did that make you feel? And what were the immediate or long-term effects? All right. And this doesn't have to be, something that's seriously overthought. I can share that for me, and this happened quite a few months ago. And the subtle interaction was one that I think, yeah, definitely fit all the definitions of being microaggression. But the thing that left a lasting impact was that when I raised this issue with someone to do something about it, it was, they kind of just didn't address it. And that was the thing that left a lasting impact for me. That eventually sort of led to me sort of recognizing that there was a difference in the values between myself and this group of people that I was being asked to work with. So for me, that just meant, it was the beginning of a separation process, right? It was the beginning of a separation and planning an exit strategy. But those small things, those tiny things, those small impacts add up. So I invite you to share your own experiences in the chat, or if you want to unmute and come on forward. Yeah, Geraldine.
I've unmuted and I'm coming forward.
Perfect.
It's interesting. I'm thinking like in what vein do you want us to answer this question? But I went right to childhood. Because there's some impactful moments in childhood. But when I was in probably junior high, which is such an impressionable age for young girls, because we're sensitive to absolutely every comment that comes our way, oversensitive. My brother called me fat, and he said I had a big ass. And I can tell you right now, I did not, and I was not. I had lovely chair rounded corners, as many young girls going into teenagehood do. But that stuck with me for years and really played into my body image and was part of a couple of other things that years later helped push me towards an interest in bulimia for a while. And I don't think I've even shared that with my brother. It's not like, what's he gonna do about it? But yeah, that had a long lasting impact for me.
Oh. Well, thank you for sharing that with us here.
Real happy one.
A real happy one. A real happy one. Yeah. Thank you so much for sharing that. We're just this kids being kids, as they say, right? But it still is pretty heavy, or it still can be pretty heavy and impactful if that's coming from a place of not understanding the gravity of those words. Well, amazing. Chantal has put a point in the chat here. I asked someone how they were doing, and the individual was offended and saw the question as superficial. Now I will be mindful of asking the "how are you" question. Right? Sometimes tiny things with good intentions that get read the wrong way. Yeah, wonderful. Lena, I see your hand up. We'll take you, and then Monique.
So I recalled a couple of situations, but I think that one of the ones that impacted me was my dad. Like, I'm from Colombia, from a Caribbean country, and like the stereotype of beauty is a woman that has big breast, big butt, and small hips. So I remember my father telling me and my mother that we have a body of like a cachaca bodies. Cachaca is the people that born in the center of the country. So we are not recognized as this kind of woman that have big breast, big butt. So he told us, like, you have cachaca's bodies, like you don't have butt, you don't have boobies. And I recall that my mother just stayed quiet. And today, not today, since too many years ago, I can recognize the impact that these kind of comments that my dad used to have has already in the image that I have from myself, and how I understand that is beauty, and how far I am from this stereotype of beauty.
Yeah, thank you for sharing that. So quite similar to, it wasn't, it's and I can get that as well, because in Jamaican culture there is a particular stereotype of beauty, and when you don't fit that, especially when you're a child or a teenager, it comes across as, pretty mean, the things that people say in order to remind you that you don't fit that stereotypical picture, and it can be hurtful. We talk about microaggressions as those small hurts.
Thank you.
Monique.
Sure. Mine is more professional related. I work in education, so there's a lot of advocacy work, and I was strongly advocating for family, and somebody made a comment about me being too spicy, and it kind of made me feel misunderstood, because I was, very polite in the interaction. I wasn't raising my voice or anything like this, or being combative or anything like that. And I guess the long-term effects would be like, now, like, since that interaction, I'm very mindful of how I communicate. And I sometimes like ask myself, well, Monique, are you going to be the spicy Monique, the spicy Caribbean girl, or are you going to be the more docile, but it's challenging, because a lot of the advocacy type work I do is against like racial stereotypes. It's so it's hard to feel like you're also trying to navigate those microaggressions while fighting to stop other people from doing the same thing. So
Yeah. Thank you for sharing that. Thank you for sharing that. And I think your point also speaks to the level of cultural incompetency that exists within even our professional work environments, like in the field of education, where there is just so much diversity and there is a need for understanding and having that cultural competence. Like the interesting and the most relevant thing that we fail to understand is that people are coming from different cultural backgrounds where the expectations and the values that are assigned to certain kinds of behaviors are very different. And Monique, you're originally from Jamaica, as am I. And it would be very challenging for someone to say to a Jamaican woman that you're being spicy. Like, it's actually the opposite. Like, if you aren't, then it's almost like they're going to say something is wrong with you, because that is just the nature of our culture, right? And so to have that sort of turned against you on top of the whole racial stereotyping, it's really quite hurtful and painful. And I've seen situations where one kind of becomes, like, what exactly am I? Where's my identity? Should I dumb this down? Should I become the imposter in order to be able to fit into this newer and expected mold, if that's how it goes, So welcome in, everyone. I see that there are some points coming up in the chat. I will read and reflect on those a little bit more as we kind of go through. Margaret Lumley wrote that her lasting interaction was being told to chin up during a distressing period by a person that was close to her. Feeling not seen and minimized was the impact. And so that actually affected how she shared in terms of her willingness to share openly, as she once did. Yeah. So please keep putting those points in the chat in relation to that question. Thank you so much for joining us for today's Mindful Lunch session. I'm really very happy to point out that this is our last Mindful Lunch session for 2024, and we have some great sessions to look forward to for 2025. But today we are focusing on the question of rebuilding from microaggressions and microtraumas. So by way of a quick introduction, I'm Pat Lee. I'm the lead facilitator and owner of Renew Mindfulness Collective. Somewhere on your screen there is SJ Nesbitt. She is the technical coordinator for our session today. SJ, give a wave or say hi. So there she goes. She's somewhere in one of the squares here. And my guest today is Robin Penner-Thiessen, who is a DEI consultant. And I'll get into introducing Robin a little bit more in a second. I just want to quickly just explain what it is that we do at Reuse. So I lead and create curricula around supporting individuals and teams using well-being and resilience tools that come through mindfulness-based stress reduction, journaling, and lived experience storytelling practices. And they're all sort of wrapped up in a conflict transformation framework. And you can learn more about ReU and what we do in the link that SGS posted there on the website. Sorry, in the chat. And I just want to start our session with just a caveat that neither Robin nor I are mental health or clinical professionals. So what we're presenting to you today in our conversation about microtraumas and microaggressions is for general information only, and it should in no way, shape, or form be taken as mental health advice, diagnosis, or treatment. And if this conversation is one that leaves you feeling a bit more distressed than you started your day, please feel free to let either myself or SJ know in the chat. But please do recognize that if you're in crisis, or you need crisis intervention, you need advice, diagnosis, or treatment, that you should consult a medical professional. And we're going to do our best to take care of our audience as we discuss this pretty heavy topic. So don't be surprised if at some point throughout our session, we kind of just take a moment to just recenter ourselves and kind of come back into the present moment. All right. All right, so I want to introduce to you Robin Penner-Thiessen. Robin is a DEI consultant. She's a speaker, leadership coach with extensive international experience. She's worked in lots of cross-cultural settings around the globe. And her commitment to DEI is driven by her desire to foster more inclusive workspaces where everyone feels valued and empowered to thrive. So Robin is joining me today to talk about rebuilding from instances where we've caused or experienced microaggressions and microtraumas. Welcome, Robin.
Thanks, Kathleen. Thanks so much for this opportunity to have this conversation. And I was just struck by the stories that people shared in the opening. One of the things that I really noticed is the person making those comments probably have no idea of the impact and how, as you reflect back, how it shaped or had this much longer term impact. And I think that's one of the many things that we'll talk about, but it just really came through in the sharing that you did. Is often the harm, the pain is so much deeper than people realize. Yeah. But thanks for the invitation, Patty.
Oh, you're welcome. You're very welcome. So Robin, so in this conversation about rebuilding from the unseen impacts of really not putting this understanding of diversity, equity, and inclusion at the forefront of our daily interactions within our various diverse identities, right? I really want to sort of hone in on amplifying some of these unseen impacts of what we call microaggressive interactions or microaggressive behaviors on overall community and mental health. But I want to start with a personal question for you. And you can go as deeply with this answer as you feel comfortable. And that is, why is this work in diversity, equity, and inclusion advocacy and training so important to you?
Yeah. It's actually a question I get quite often. People wonder when I say this is what I do. I'm passionate about inclusion, and especially I focus on inclusive workplaces. And people kind of look curious sometimes. And it really is, it is deeply personal for me. I will say that when I was first married, it goes way back, early 20s, my husband and I moved to Kenya, and we lived there for 7 years. And we adopted our first 2 children while we were living there. So here's a picture of my family. It's me and my husband, our 3 kids, and our daughter's wedding, which was last month. She just got married in October in Alberta. So she married a young man. His last name is Mutate. He's originally from Zimbabwe, lives now in Alberta. But this is my family. And so over the last 20-some years, as we raised our family primarily in Manitoba, I always say that I had a front row seat. I wasn't experiencing microaggressions. I wasn't experiencing racism myself, but I had a front row seat to what my kids were experiencing. And my background, most of my career was actually human resources. So it was really in that context of noticing other employees or my colleagues' experience and reflecting. And it kind of came more and more as my kids got older, got into high school, and I started to think about their experience in the workplace, because I was noticing, who was less centered, who felt like they belonged, who were the people in leadership positions. And it hit me that my kids' experience would be very different than mine was. And it would be because of their skin color. Like, I just started to notice that so much. And as I leaned into that, I also started noticing other people who probably were feeling a little more on the fringe, whether it was because of their sexual orientation or disabilities or religion, like all of the differences that were impacting what it was like to be in the workplace. And so I decided, I made a shift then from my career in human resources to thinking, what could I do? Like, how could I make a difference to create more inclusion? And that really is what led me to founding my consulting work and doing what I do today. So yeah, that's kind of where it all started with my kids.
Thanks for sharing that, Robin. You have a beautiful family, by the way.
We looked pretty good on that picture, I'll say, but it was a wedding.
Lovely. So Robin, help me set the stage for understanding why we all have work to do with microaggressions and microtraumas. So let's start by maybe painting a picture of what these things are to begin with. So maybe you can tell us what microaggressions are. Like, how
Yeah.
are we supposed to understand this?
Right. Because I do talk over the years and in different places, I've actually done a lot of work around microaggressions, and I find it's not a very familiar term. It's not one that people have used that much. So I think it's great, Patly, to start with just that, like, what is it? The definition that I usually give is they're comments that are based on some kind of stereotype. Well, let me back up and say they're really common comments. They're everyday, they're behaviors that happen all the time. Often they're unintentional, although they can be intentional. So everyday comments, behaviors, intentional or unintentional, and they communicate some sort of bias towards a culturally marginalized group, which is to say, usually based on a stereotype of someone's ethnicity or skin color or religion. All of the different categories, we'll probably talk more about, maybe some examples through our conversation, but a few things, if I can just like highlight, is how they really are unintentional. It was a bit what I was mentioning earlier about the stories that you shared. The person often isn't intending to be unkind or rude. To be clear, sometimes people are, it is their intention, but often it's what people find the hardest to understand about microaggressions, because the people who aren't the target, who are maybe the ones making the microaggressive comments, they will be thinking, I was giving them a compliment, or I was trying to be friendly. I was joking, right? Don't take it so seriously. There's all of these like rationale or kind of thoughts around why the person made the comment. So often unintentional. And again, some of us in this room, or in this virtual room, we might think like, I honestly was intending to give them a compliment or trying to be friendly. So I find that that's one of the most important things for people to kind of that really sit with is our good intentions doesn't take away from the impact. And I know we'll talk a little bit more about impact later, but that's just one of the things that I want to really highlight. And then the two things are around like it's towards a marginalized group. So it's not a microaggression if it's targeting someone that's not marginalized. It can be a rude comment, it can be unkind, it can be hurtful, but to be considered a microaggression, it is typically, or it is around a marginalized group. So for example, if you make a comment about someone's tan, if it is someone that is from, maybe they're a Black or brown person, and you say, oh, you're so lucky, you already have a tan, or look, I'm almost as dark as you are, look so exotic. All of those things actually are considered microaggressions, whereas if they're said to someone not marginalized, they're just, taken in a very different way. And that whole idea of bias, like where often that impact is, I often call it, it's othering, like it sends a message like you're here, but you're obviously not really part of the group, or you might be part of the team, if I think of workplace settings. So it communicates a bias of othering, and you're not really one of us. So that's where, again, when we reflect later a bit on impact and trauma or what it has, is that repeated othering of someone just because of one of these characteristics. And I'll just give maybe two quick examples about how it can sometimes be communicated or experienced, I should say. So my son, from when he was a teenager, he is often watched by security when he goes into a store or the mall, like followed by security. And so that's communicating the notion of you're obviously not trustworthy, or you might be dangerous. When women clutch their purse a little closer, when a Black man maybe passes them on a street. Another example that happened quite often is our daughter. When she first moved to Alberta, she was working at a Walmart. And when she would go shopping at the Walmart, when she wasn't wearing her uniform, her vest and her name tag, so she was just off duty, whatever, she was often followed by security because must have been because of her skin color, because there was something about her that they felt they needed to keep an eye on her. So these are all communicative bias, something about being a little bit dangerous or a lot dangerous that can be experienced. So, and I could give lots of examples. Maybe I'll just pause there. And again, I'll just say, though, often the more subtle comments to the people who aren't the targets, they think of them as pretty small and insignificant, and yet they really have a lot of impact. That's what microaggressions are. I know we want to also talk a bit about microtrauma. So let me pause, Patli, and turn it to you to talk about how you would explain or define microtraumas.
Yeah, and thank you for that, because I think that, you know, the point that you made about the term microaggression really being sort of reserved for comments and actions that are really around communicating some sense of othering to a marginalized group. So, and that usually is based on some kind of stereotype, and it's typically based on some kind of racial or ethnic stereotype. You know, one super common thing that people tend to put out as a compliment that they don't necessarily realize is not a compliment is, oh, your English is so good, or you write so well, you know, to say that to an individual, which is that definitely that cementing this idea that you are from somewhere else, you know. But I always like to try to put this into context that microaggressions are just one form of microtraumas that a person can experience. And like we saw at the beginning with, you know, responses to our connection question, where we are sort of speaking to, you know, we're hearing from persons who do not necessarily fall within a quote unquote marginalized or ethnically diverse group, but they experience invalidations, right? You know, dismissing an emotional or an experience, making someone feel minimized or unheard, even if they are a part of the dominant or majority group. That's one form of micro trauma, right? Or a micro trauma, or can be counted as a microtraumatic experience. Microaggressions, those small comments and actions that imply stereotypes or bias, that's another form of microtrauma. And even just ongoing exposure to workplaces or social or familial environments that are subtly hostile or unwelcoming. You know, when you have a parent that tells you that you are akin to external or outside group in your physicality, like what Lena had pointed out. Those are examples of microtraumas. So microtraumas are really the small and often subtle experiences or interactions that accumulate over time. And that accumulation leads to psychological distress. And unlike major traumatic events, you know, microtraumas are typically very minor incidents, such as, you know, the discrimination, the repeated invalidation, the everyday slights that contribute to that ongoing stress, that ongoing questioning of one's value, one's purpose. You know, do you even deserve to take up space? Should you alter the way that you present yourself? Should you stop eating? Should you eat more? Should you eat less? You know, all of those things that can affect our personal psyche on a deeper level. So I have another question for you, Robin, but I think I'll turn it over to our audience for a second to sort of ask them, how do you think microtraumas and microaggressions, especially those that go unaddressed, right? The ones that are sort of, you know, the slights happen and everybody kind of moves on. How do you think that influences someone's sense of belonging or safety in either the workplace or the family or community setting where those things happen? So I think Esther has posted a question in the chat there. So how do you think microaggressions, especially those that go unaddressed, influences someone's sense of safety or belonging in a workplace, family, or community setting? Yes, Carol.
So I think long term, what it does, it creates this internal voice, that inner critic, it becomes a little bit louder to the point where you start to internalize things, and your sense of self kind of just starts to wither away over time, to the point where at some point you just don't exist. That sense of being doesn't exist anymore, and you feel out of place, is the first thought that comes to mind.
Mhm. Yeah, thank you for that. Yeah, that totally makes sense. And it's the having to take the time once you get to that point where you recognize that that is what has happened. And for a lot of people, it takes them decades to discover that, oh, that's what happened. And then to try to work to bring all of that back, right? Yeah, Monique.
I think of kids, and what I see a lot is that when those microaggressions become are not addressed, it actually makes them bring up other past trauma, because that safety and belonging is threatened. So even though they're no longer in like say crisis situations, they still have those same feelings.
Mm-hmm. Mm-hmm. Yeah, that's a very good point. So that continuation of the death by 1,000 cuts type of scenario here. Robin, what have you discovered about the toll and impact of microaggression, especially those that go unaddressed in your line of work?
Yeah. Well, and there's so many things we could talk about in terms of all of the mental health implications, and we want to talk a bit about that, or kind of at least start talking a bit about that. But it's very, I guess, significant that each one on their own does seem kind of minor or trivial often. Like it seems like such a small comment, and this is where like your comment, Pat Lee, of death by 1,000 paper cuts, like one paper cut, like nothing, it stings a little bit. It's the cumulative effect. And when they do go unnoticed, unaddressed, and they happen over and over and over, 1,000 paper cuts, right? You can bleed to death from 1,000 paper cuts, or lose your sense of self, as was shared. So it's the cumulative effect that's devastating to the person who's the target, and yet is often totally missed by people who aren't on the receiving end of it. And there's a quote that I like to share, because if people are thinking like it's not really a big deal, it's maybe, someone had their feelings hurt by a comment. And one of the examples that I'll also share, like my daughter, when she was in junior high, or I'll start by saying comments about Black women's hair is a very common microaggression. And it started very young for our daughter, where she used to rotate kind of between having her hair chemically relaxed or having it in extensions or wearing it natural, maybe just in a small afro. And there came a point where she refused to wear her hair natural to school anymore. She just wouldn't. And I kind of, encouraged her, because I'm like, I said, Malika, you look super cute. You totally rock that afro. And one day she told me the kind of things that kids said to her at school, and the way they teased her and said, like, did you stick your finger in an electric socket? Or her nickname was Aunt Jemima from the pancake syrup. And how those nicknames and comments and seemingly trivial comments really impacted her self-esteem. And in fact, I was just thinking, I don't know that I've seen her wear her hair natural since then, ever out in public. So this quote that I wrote down that I wanted to share, it's by Dr. Roberto Montenegro, and he says this: "It isn't about having your feelings hurt. It's about how being repeatedly dismissed and alienated and insulted and invalidated reinforces the differences in power and privilege, and how this perpetuates racism and discrimination." So I just think we should think or sit for a minute about this idea of the impact of being repeatedly dismissed and alienated and insulted and invalidated. And there's a growing body of research that's looking into all of this, of how it impacts mental health, things like higher rates of mortality, higher rates of depression. Even they're linking a lot of like microaggressions to PTSD, post-traumatic stress disorder, like the impact is being measured and it's significant. And I think some of that is in line with what you're also finding with micro traumas. Is that what you're finding, Pat Lee? That, you know, we use the word micro, but really the impact is not insignificant.
You know, you're absolutely right. The impact is not insignificant at all. And in fact, when we look at it from the broader sort of realm of micro traumas, what the research and the lived experience and the observing of people in their lives, like with the work that I do with working with clients who are highly stressed, who are feeling burnt out, who are trying to change the relationships with the people that they work with or their family members. One of the things that what I've noticed, and that it comes up in the literature as well, is that there are lasting interpersonal and intergenerational effects of these repeated dismissals and alienation and insults and invalidations that just get passed on from one person to the next and one generation to the next, unless there is a point of intervention and change. People who repeatedly experience micro traumas also, you know, report experiencing higher levels of chronic stress. They have higher levels of distrust for community and social institutions. They have poorer quality relationships. They have lower sense of self-worth. And what happens is over time, these individuals, they develop a heightened sense or a heightened sensitivity to rejection and exclusion. And that also affects their interactions and sense of belonging. And so intergenerationally, what happens is that it gets, you know, all of these things kind of get passed down as coping mechanisms that, you know, people feel that they need to sort of wear that mistrust and insecurity, but it influences their family dynamics in a lot of ways. So for example, you know, the internalization of the microaggression, as some of our audience members kind of pointed to, leads to that sense of self-doubt and that imposter syndrome that leaves people feeling so guarded. They don't want to let people in. And sometimes those people that they're not letting in are their family members, people who are closest to them. And it also affects parenting styles and family dynamics. You know, there's lots of information out there that tells us that parents who've experienced micro traumas and repeated invalidations, they unconsciously transmit those as cautionary beliefs and fears to their own children. And so what you have is that cycle of family and interpersonal violence and domestic or partner abuse that just continues from one generation to the next. And then there's a bigger issue of community trust, like the long-term exposure to all of those discriminations kind of leads to that erosion of trust in our social institutions, right? We worry about what our kids are gonna be learning in school. Are the schools and the teachers gonna protect them? You know, there is that feeling of needing to isolate yourself. There's that loneliness. There's that sense of there isn't a safe space. There, you know, sometimes it's even in the third spaces that we try to occupy, you know, the first space being our workplaces and our families, but then finding that we don't have a safe third space to be able to go to a place outside of our home where we can develop those connections and belongings because we lack that community trust or we're feeling so insecure after these repeated instances of, as you said in that quote, alienation, repeated dismissal, insults, invalidation. We're just kind of walking around, kind of waiting for the next thing to happen, right? And it takes away that sense of hopelessness.
Pat Lee, can I jump in and also say one other thing that I was just thinking about while you were talking? With part of also with mental health and impact is when no one around you has noticed, like someone makes a comment and you feel it, but you also notice like no one else reacted. Nobody else thought that was totally inappropriate or that was offensive or that might have been a hurtful comment. And so that adds to like, maybe I'm like overreacting and it causes you to self-doubt and mind games. And then that kind of adds to like, well, if I speak up, should I say something? But then if they just say like, no, you're overreacting, or I was just kidding, right? It adds to that mental health impact or that heaviness and that weight. And this is where, and I know we're going to talk a little bit about how do we respond or how can we be allies, active bystanders, but to speak up in that moment as an observer, or to follow up with someone later to say, you know what, when I heard what was just said, or I saw what happened, and I just want you to know I noticed, like that can really be helpful to the person who is doing that sort of self-doubt, playing it over and over, thinking, did I hear what I thought I just heard? So that's one of the things I wanted to mention. And also there was a lot of research coming out of sort of the pandemic era, when people went to remote work, and then that whole coming back to the office. People who felt safe because they could stay in their home and join meetings by Zoom or Teams, because of all of the microaggressions they were experiencing at work. Like it comes through in so many, every level, like from people in the C-suite, how that anxiety that it caused as they thought about having to be in person and realizing that they'd had those months or year, whatever it was, of sort of being in that safe space and not being constantly exposed or experiencing microaggressions. So those were just two other thoughts I had to kind of the impact and how real it is.
Yeah, thank you for that, Robin. Yeah, those are actually very good points, and I want to follow up with that that point about what can we do, and end on that point of hopefulness. I just want to call just sort of bring bring out some of the stuff that's coming up in the chat. Pam Bailey writes that she when think about the Brené Brown idea that to the effect that if you can't disagree, you can't challenge the norm, or you can't talk about or concern or issue with a group or family, you cannot belong to that group. That is part of that sense of lack of community trust, right? And it kind of comes back to that point you made, Robin, about our voice being the only voice that is going, wait, what happened here? That didn't seem right, and no one else is validating that some kind of injustice just transpired. And Christine points out that there is that continuous self-editing and the putting up walls, so you just can't relax and be yourself. SJ tells me that we're doing pretty good for time, so I just want to take just a minute to kind of sort of recenter ourselves within this, because we're talking about a pretty heavy topic, and even just for me, just talking about, I feel the weight of talking about experiences of microaggression and microtraumas. So I just want to engage in just a few seconds of audience care in just bringing us back to the present moment, with just an encouragement to, and you can go follow along with this. It's all by invitation. So to whatever extent you feel comfortable, you can keep your eyes open or closed, but just taking a moment to just find yourself sitting in your chair. And by that, I mean just taking a moment to remind yourself that your body is sitting physically in your chair. So feeling your buttocks on the seat. And like I said, if it's comfortable to keep your eyes open, do that. If you want to close your eyes, that's fine. And then just take a moment to just place your hand or both hands on your chest, right about where your heart is. And if it's available to you, taking a moment to feel your feet in contact with the floor. And just taking a couple of breaths in this position. Taking a moment to follow up with one more inhale, as deeply as you can make it. And then a long exhale, as long as you can make that exhale. When you're ready, just returning to the room. All right. So, Robin, I wanna be sure that we end this conversation on a note of hopefulness. We're seeing a lot of conversations in the chat that, when there is when there's no bystander action, and I'm quoting Lena here, when there's no bystander action, the likelihood of developing a deeper wound increases, as does the likelihood when microaggressions were made by someone who was intended to care. And I'm just thinking back to what Lena had mentioned about the comment from her father about her body, right? That's what I would call more of an invalidation as opposed to a microaggression. But it really just depends on how you want to break down the circumstance and the situation. But when we have that no bystander actions, when people who should be protecting or be having that sense of allyship don't take up that mantle, that's when the wound deepens, I think, and we tend to suffer a lot more. So, Robin, what strategies would you recommend for people who realize that they have said or done some things that were microaggressions, or even for people who have experienced or seen these actions that are microaggressions taking place?
Yeah, no, I think that's really good to, I mean, and thanks for doing that breathing exercise, because you're right. It was feeling, it's heavy. It's a really heavy topic, both for people like who are targets, have experienced them, but also for when we realize like we are people, you know, have said some of these things or may have been unintentionally causing harm to our colleagues, to our friends. So I appreciate the breathing exercise and ending with some strategies, some things that we can do. And I'll say three things kind of as my recommendations or some things to think about. One is, as we think about things we might have done that have caused harm, or that we have sometimes been the perpetrators of a microaggression, I always love the quote by Maya Angelou: do the best you can until you know better. And then when you know better, do better. And so I always try to be reassuring, like we're doing the best we can. We didn't know before. And it's not about, I don't think using guilt and shame as sort of a way for transformation is a really effective. It is more like, yeah, we've been doing the best we can. And now that we know a little more, have maybe new information, we can do better and we can change our behavior going forward. And in fact, when I've done these workshops in workplaces or with school groups or even with boards, I've had people come back and tell me that they went to a colleague and apologized, or they realized that something they had done, they could go and try to repair some of the harm. So that's one of the things. One is it's empowering. I find that learning more and more about what are these comments or behaviors, we can change them once we know better, we can do better. So change behavior and then following up to repair is something we can kind of do to heal from the past. And then thinking of going forward, what does it look like to change the way we relate to people or ask questions? And because we want to encourage people to be friendly, we want to be able to give compliments, like those are good things. But what I would encourage you is to think for about, like pause for about 10 seconds and just ask yourself, could this be a microaggression, or could this comment or question or compliment that I'm giving, is there a way that it could be othering that I hadn't thought of before? And so I often just say, like, ask better questions, like just take that bit of extra time to reflect and think of how could I word this in a way that won't send a message of, like, you're obviously not from here, like your English is so good, or your skin is so exotic, or can I touch your hair? Is that your real hair? You know, like just take that bit of time to ask better questions and to be friendly or show interest in a way that doesn't send a message of othering. So those are sort of the first two. And then this is maybe more of the how to be an ally or active bystander. And we have actually a toolkit, I think, to send to you afterwards with just some strategies and scripts, because what I find is we often want to say something in the moment and we don't know what to say, right? It's later, you're like, oh, I should have said something. I wish I had spoken up. So one of the things you can do is follow up later. Like if it is in the workplace or if it's with a friend, like later you can go and say, you know what, I'm sorry I stayed silent. I wish I had said something, because that then kind of interrupts that mind game the person might be thinking, like, did I really hear what they said? Or so you can follow up later, but we'll also send you some scripts of like, these are things that you could just keep in your back pocket to bring up like asking a question like, can you repeat what you just said? Did you, what did you mean by that? Like sometimes it's just showing curiosity to help that person to maybe rethink what they, what did they just say? What came out of their mouth? Maybe they want to say it differently. And in fact, one of the things we often do in our workshops is like role play, because practicing, like put into practice, like how would it feel to interrupt a microaggression or to address something that happened? And so maybe my strategy or my tip for being an active bystander is to really spend some time with that toolkit, with that list of things that you could try or questions you could ask that could help you kind of to equip you in the moment, because it is really hard to think on our feet sometimes, and especially if it's a bit of an awkward moment. So those would be the things that I would recommend to try to avoid saying things in the future, or to be able to be an ally. And Pat Lee, I think you have some things like, what if but how do you repair and rebuild when you're the person that's been the target?
Yeah,
And that's
and
a whole another conversation.
yeah, that's a whole other conversation. But I just want to just reinforce again that Speak Up tool that you've shared with us. We're going to send that out in the email after with the follow-up resources, along with some of the other tools that are available related to this conversation. But yeah, you're right. So what happens to the person who, as a result of all these micro traumas and microaggressions, has to over their lifetime self-edit, put up their walls? They can't relax, they can't be themselves because they are constantly guarded as a result of those things that people say, that a lot of people just dismiss, and oh yeah, you should just live with it. Well, the thing is, like, people have to learn to rebuild. Like, you have to learn to rebuild. You have to learn to take a step back. You have to, these are all just like individuals have to learn what not to say, or learn to ask better questions in a diverse and increasingly diverse community. We as individuals, I believe, and this has nothing to do with victim blaming or anything, but I believe that we can become agents and really sort of take the time to learn how to rebuild and how to repair ourselves. It takes time, and it's a lot of work, but it is really, really beneficial work that can help to remove that sense of, or rebuild yourself after you've done that withering away, right? To learn not to self-edit, to regain that sense of confidence, to regain that sense of authenticity. And the whole idea is to avail yourself of resources that can help you do exactly that. I know that for me, the work that I do with mindfulness-based stress reduction and storytelling work is really helpful for the people that I work with being able to reestablish that sense of self. For other people, it might be something different, but explore those options. Those are always good. And keep the road to the conversation open. Being curious, as you said, Robin, being curious, as you said. All right, I think we're gonna have to leave it there. Robin, thank you so much for joining me today.
My pleasure. Thank you so much for having me, Pat Lee.
This has been a very valuable and filling lunchtime conversation. We're going to share in the chat once again the contact information for Robin, as well as a link to the ReU website. We're going to share Robin's microaggression response toolkit and other resources from today's session by email follow-up afterwards. But folks, the conversation continues even after this online session ends. You can join us in the ReU community group to continue discussions about rebuilding from microaggressions and microtraumas. It's a free to join group. You can also join us in one of our programs to learn more about growing your chronic stress resilience with MBSR practices or storytelling practices. And you can find more information about that on the ReU website. Thank you so much for joining me today. Walk good, everybody.